Many of the exams done at your eye doctor's office check your vision, but some of them check your eye's health, and they also look at specific parts of the eye. Some of the eye conditions have no early symptoms you'd notice, so these tests are important to see how healthy your eyes really are. Let's take a look at a few of them, including what you can expect and what your doctor is looking for. One of the main tests your doctor might do to understand your eye health is called a dilated eye exam. It's often part of your regular yearly appointment, and it may be done more often if your doctor recommends it. For example, if you notice changes in your vision, or if you're at risk for an eye condition. To get ready for a dilated eye exam, you'll first be given medicated eye drops that widen your pupils so the doctor can more easily see inside your eyes. The drops take about 15 or 20 minutes to work, and you'll probably be asked to sit in the waiting room while your eyes dilate. Don't be surprised if your vision becomes more blurry and your eyes become more sensitive to light as the eye drops take effect. This is normal. Once you're back in the exam room, you'll sit down and look into a device that helps your doctor see into your eye. Your chin and forehead will rest on supports to help you stay still. Then the doctor will look into your eyes using a light and a special magnifying lens. The light may seem very bright, but this exam usually takes just a couple of minutes. This test is done so your doctor can look at the back of your eye and your optic nerve, which helps them see or rule out several conditions. For example, if they notice changes in the shape or color of the optic nerve, this could be a sign of glaucoma. If they notice red dots or leaking blood vessels, this might suggest diabetic retinopathy. And if the doctor sees yellow or darkened spots under the retina, this may point to age-related macular degeneration. The goal is to find out about any problems as soon as possible. That way, you can start any treatment you need right away, which can help keep your vision from getting worse. When your eyes have been dilated, your pupils will stay wide for a few hours, which means things will continue to look very bright and somewhat blurry. It's a good idea to plan ahead by bringing sunglasses and arranging your transportation or assistance so you don't have to drive, and you'll have any help you may need. It's also helpful to avoid reading or looking at a smartphone or computer screen for a while, along with any other activities that may cause your eyes to strain and become tired. If you don't have your own sunglasses, your doctor's office usually has a disposable pair that they can give you, or a set of tinted shades that fit over your regular glasses. Another test that might be performed while your eyes are dilated is called an Optical Coherence Tomography, or OCT. With this test, the doctor uses a special camera that takes a picture of your retina. For this exam, you'll sit in front of the OCT device with your chin and forehead supported, and the machine will scan your eye without touching it. It takes about 5 to 10 seconds, and you may notice a brief, bright light when the pictures are taken, usually 1 or 2 pictures per eye. Using these pictures, the doctor can measure and check the layers of the retina, notice if there's any swelling or buildup of fluid, and look at the optic nerve fibers. Once again, this can help with finding and treating different eye conditions, and it can help your doctor check other conditions that could affect the nerves in your eye. OCT can help the doctor find things earlier than other types of testing. If OCT is used, it's likely to be a part of your yearly exam, or sometimes your doctor will recommend a different schedule, depending on your eye health, family history, and risk for different eye conditions. Finally, one more way your doctor checks the health of your eyes is with tonometry, a quick test that checks the pressure within your eyes. To prepare your eyes for this test, you'll be given eye drops that quickly numb the surface of your eye within a minute or two. For the exam itself, there are a couple of different ways it might be done. You might rest your chin and forehead on a device that applies a quick puff of air to one eye and then the other. This doesn't hurt, but it can surprise you. Or your doctor might use a device to quickly touch the surface of each eye. You won't feel it because of the numbing drops. All you need to do is look straight ahead and relax while the test is being done. Tonometry is generally done as part of a regular yearly eye exam, and it may be done more often if you're being treated for glaucoma. It helps your doctor identify and monitor glaucoma by detecting any change in your eye pressure well before you're aware of it. The normal range of pressure is generally a measurement between 10 and 21, although there's no single number that's best for everyone. You can ask your doctor the numbers for your pressure readings and what your healthy range is. Check out the resource section for more information on different eye conditions and to learn how they affect different parts of the eye, as well as what you see. Knowing what to expect from the different eye tests your doctor does can help you feel more comfortable ahead of time and at the exam. And if you have questions about anything at all, you can always ask your doctor to describe what's happening and what they're seeing. Be sure to ask about your results and what they mean for you. And always feel free to follow up and get more information about anything you don't understand. Hadley's here for you too. As always, if you need more information, reach out to a Hadley learning expert to learn more about how to make the most of your vision.